Hi, my name is Jamil, and for this demonstration, I'll be demonstrating the proper decontamination of 4 surgical instruments using the manual 3-sink cleaning process. The instruments I'm cleaning today are clamp, scissors, forceps, and a suction tip. To stimulate bioburden, I contaminated each instrument using safe household materials, barbecue sauce, and allowed them to dry overnight to mimic dried organic debris. The goal of decontamination is to remove visible soil and reduce microbial contamination so instruments can safely move to the next phase of reprocessing cycle. Before beginning decontamination, I'm wearing the appropriate personal protective equipment. First, I have on gloves to protect my hands from contact with contaminated instruments and cleaning chemicals. Next, I'm wearing a fluid-resistant gown to protect my clothing and skin from splashes. Next, I have on my face mask to protect my nose and mouth from droplets. PPE helps reduce exposure and supports safety when handling contaminated instruments. The first sink is the wash sink. It contains warm water, ideally according to the manufacturer's instructions, along with a detergent solution. The detergent I'm using today is a Gain Tide Pod. For real instrument processing, enzymatic or low-foaming neutral pH detergents are commonly used because they help break down organic debris while protecting instrument surfaces. The instruments remain fully submerged during cleaning to reduce aerosolization and prevent contaminants from becoming airborne. This second sink is the intermediate rinse. It contains clean water. The purpose of this rinse is to remove loosened debris and detergent residue after washing. In an actual sterile processing department, this rinse may use treated, deionized, and distilled water depending on facility policy and manufacturer recommendations. The purpose is to remove any remaining detergent residue and reduce mineral deposits before inspection and drying. As part of proper decontamination, the instructions for use, or IFU, must be followed for each instrument. For the clamper scissors, IFUs generally recommend keep boxing locks open during cleaning so all surfaces can be reached. For tooth forceps, IFUs recommend cleaning carefully between teeth to remove debris. For suction tips or lumen devices, IFUs typically require internal brushing and flushing with the correct size cleaning brush. IFUs also guide detergent type, water temperature, cleaning methods, drying, inspection, and sterilization requirements. Following IFUs is essential because improper cleaning can damage instruments or leave debris behind. This is my clamp. It was fully submerged. I'm placing it back into the water. The clamp is open to expose the box lock and all contact surfaces. Using this brush, I'm cleaning from the least complex surfaces towards the box locks. I'm focusing carefully on the hinge and serrations because debris commonly collects there. Keeping the instrument submerged helps prevent splashing and aerosolization. Once visible soil is removed, I rinse it in the intermediate rinse and then I move it to the final rinse. After rinsing, I place it aside for drying and inspection. Bring the camera down here. These are the major scissors Submerge. These are the forceps. These are the Addison tissue forceps with teeth. These are tooth forceps. I'm cleaning them while submerged. I'm brushing the entire surface and paying close attention to the teeth and tip. I'm also cleaning the side surfaces and alignment points. This is my suction tip submerged. I'm inserting a pipe cleaner to make sure they didn't have any debris left. Once that pipe cleaner is inserted, it's able to get any excess debris in the inside. While I have that in there, I'm also going to scrub the outside while still submerged. These instruments are cleaned in this manner to remove visible debris from every external and internal surfaces. Opening hinge instruments exposes hidden areas. Brushing lumens removes internal debris. Submerging instruments reduces aerosolization. Following a consistent cleaning process helps protect the instruments and support patient safety. The instruments is in its final stage, which is the third stage, is soaking in clean water to remove the excess debris from the detergent. These are the Mayo scissors, dried, no debris. Forceps, dry, no debris. Suction tip, dry, no debris. Clamp, dry, no debris.